This is my poster board on congestive heart failure, better known as CHF. I have some facts up here about congestive heart failure. I also have my diagram, as you can see. I have my references in the corner. It's three of them. Two are at the book, and one is off the internet. Hi everybody, my name is Shamice, and I'm doing my oral presentation on congestive heart failure, as you can see, better known as CHF. CHF is a chronic condition that affects the pumping power of your heart muscles. CHF has many signs and symptoms. For example, shortness of breath at night, shortness of breath when you're laying down, and shortness of breath when you're exercising. You can lose your appetite as well. Heart failure can occur if the heart cannot pump systolic or fill diastolic adequately. One of the causes of CHF is high blood pressure. CHF requires medical diagnosis and lab testing. If you want to prevent CHF, all you have to do is stick to a healthy weight, reduce your stress, get enough sleep, and exercise on a regular basis. If you do get CHF, you can have a coronary artery bypass. At this time, there is no cure for CHF, but if you take beta blockers, it can help. Or in some cases, get a pacemaker, which that calls for surgery. CHF is a major public health problem. 1 to 2% in middle-aged and older adults, 2 to 3% are older than 65, and 5 to 10% are older than 75. With CHF, you can have water retention, and the disease can last for years or be lifelong. The type of doctors you would have to see if you have CHF would be a cardiologist, a PCP, which is your primary doctor, a cardiothoracic surgeon, cardiac electropsychologist. There are 4 stages to CHF. Stage 1. You don't experience any symptoms during typical physical activity. At this stage, it can be managed through lifestyle change and heart medication and monitoring. Stage 2. You're likely comfortable at rest, but normal physical activity causes fatigue and shortness of breath. CHF at this stage can be managed through lifestyle changes, heart medication, and careful monitoring. Stage 3. You're likely comfortable at rest, but there's a noticeable limitation of physical activity. Even mild exercises may cause fatigue or shortness of breath. Treatment can be complicated. Talk with your doctor about what heart failure at this stage may mean for you. Stage 4. You're likely unable to carry on any amount of physical activity without symptoms which are prevented even at rest. There is no cure for CHF at this stage, but there are still quality and life options. You want to discuss the potential benefits and risks of each with your doctor. Although there have been recent improvements in congestive heart failure treatments, researchers says the prognosis for people with the disease is still bleak, with about 50% having an average life expectancy of less than 5 years. For those with advanced forms of heart failure, nearly 90% die within 1 year. CHF is a very severe disease. It does not have to be a death sentence. CHF is a progressive disease that can be treated in its early stages. Heart failure does not mean that your heart has stopped beating or that it has failed. It means your heart is weakened and it is not pumping as well as it should be. CHF has no simple cause. It also has no simple treatment. CHF is the disease, process, and conditions that affect the heart. CHF is the failure of the heart to carry out its function.